Thank you very much and welcome to the Entrepreneur Channel. Today, we will be discussing about something that is particular to women, and that is fibroid. Discussing that with me today is a gynecologist and the CEO of At Last Medicare, Dr. Bimbo Okusanya. Dr. Bimbo is glad to have you today.
Thank you. Thank you.
Okay. What is fibroid? Like, people want to know what is fibroid.
Fibroids are the layman terminology for a gynecological condition which we usually call leiomyomas. Okay? These leiomyomas are usually benign growths in the uterus. The uterus is what the layman calls the womb. So these fibroids are growths that are benign. Usually, neoplastic growths are classed into two broad classes. We have the benign type, which means they're generally harmless, as in not really that dangerous. And then we have the malignant type, where you have the cancers. So usually, fibroids are benign, but they can become malignant if not attended to on time, especially when the woman now becomes menopausal.
Okay. Okay. So, what is the cause of fibroid? People say every woman has fibroid, but some manifest and some are just mild and they don't affect the woman. What really is the cause of fibroid?
Okay, thank you very much for that question. The cause of fibroid is actually unknown. Is actually unknown, but we have a lot of postulations as to why they may occur. Now, not every woman has fibroids. Let me make that correction. Fibroids is actually really more particular to the Negroid race, the blacks. Fibroid is actually a disease of the blacks. So, from statistics, I don't know the present day statistics, but before, 5 of every 8 black women will have fibroid seedlings.
Wow.
5 of every 8. But the issues with fibroids is two ways. It's either the size or the site. So that's it. 5 in 8 black women, if you examine them laparoscopically, you will see fibroid seedlings. But what we usually deal with are the fibroids that are symptomatic. Because if you're not having symptoms, naturally, in our climb here, we don't seek out, we don't do medical checkups until we have symptoms before we present in the clinic. Yeah. The main issue with fibroids, you see, I don't know if we'll be able to have enough time. It's a very broad topic. So
Okay.
usually,
So you just summarize for us
yes,
for
that's what I want to
layman
do.
to understand. Yes.
What usually makes the women to seek out treatment is when they have symptoms. These symptoms are many. They may be bleeding. They may feel a swelling in their abdomen. They may be finding it difficult to get pregnant. Those are the 3 main reasons why they seek out help. Either they are bleeding excessively, they're having a bloated stomach, or they are finding it difficult to get pregnant. Okay? So, but what we've noticed is that fibroids now, they are becoming more common. Reason being that the age of marriage is being lengthened by education. In the olden days, in the days of our dads and our granddads, the girls were getting sexually exposed from 16, 17, 18. And by 20, most girls already had children. So we have a common saying in gynecology that bad girls get pregnant, good girls get fibroids.
Really?
So, yes. So, if you're constantly using your uterus, if you're getting pregnant every year or every 6 months, the chances of the fibroids that are there growing, because the uterus is busy, it's like having a clean hotel room and nobody is staying there, and you have some urchins looking for where to stay. If they see that place is unoccupied, they go in there and they just be living there because nothing is challenging them. But if the uterus constantly carries babies, is constantly working, then the chances of the fibroid growing is quite minimal. Okay? So fibroids can be big and not even be symptomatic, but they can be small and they can cause problems, especially if they're on the cervix or they are on the cornua, which is the mouth of the tubes. So most times when people come, it's because they're trying to get pregnant or they're bleeding excessively or the fibroid is so big and it's causing a discomfort for them.
Okay. So that means that stage, it could have been severe before they get to that stage, right? So how can
Yes.
a woman discover? How can a woman find out before it gets to that stage where she's bleeding, where she couldn't conceive? How can she know earlier?
Thank you very much. What we advocate is that every woman, every young adult should have a test, just a simple scan. Okay? Once you just have a scan, if it's a scan, just a pelvic scan, will show you. And now, if the scan is indicative of anything, then we can take it up from there and do further tests and advise you accordingly. There's some people that they come early, we get the fibroids out, and we advise them that you need to get pregnant as soon as possible. I've even 20, 21-year-olds, you just have to tell them, because once the fibroid is out, the thing is that you can never take out all the fibroids unless you want to take out the whole womb. You can never take out all.
Wow.
You just take out the ones you can and try and preserve the womb so that the womb can still carry a child. Because if you disfigure the womb too much, you are not doing the person any good. You're not really doing them any good. Because in our climb here, what we really want is to have children. That's the main thing. That's our main aim. We want to have children. That's why they come. So even women of 52, they'll tell you, please don't take out my womb. I just have a new babalanu. You know, they just want to have children. So you take out, but the thing with fibroid is, as I said earlier, is if you have a fine hotel room and nobody's staying there, after fibroid surgery, 6-9 months later, if you don't get pregnant, the fibroids will start to grow again. It's just so sad. That's the way it is.
Wow. Okay, so what is the treatment for fibroid? I know there is surgery. What are other treatments for fibroid?
Yes, the definitive treatment is surgery. The definitive treatment is surgery. That's it. Now, there are also some newer techniques that they're using. There's some drugs that you can take. There's some drugs you can take. And then if you're not ready for surgery, there is a device that can be put into your womb that will slow down the growth of the fibroid. And then it can reduce the size of the fibroid, but it will not eliminate the fibroids. So that's it. The definitive treatment is to have the fibroids out. The definitive treatment is to have the fibroid out.
Okay. So like you said now, you can't remove it completely, meaning if you don't conceive over a particular time, it will still grow again.
Yes,
Can't
because
there
you see,
be okay?
the thing is that with your human eyes, you cannot even see all the seedlings. You can't see all the seedlings. Okay? You can't see all the seedlings. Some are very small, like rice. Some are just like a grain of rice. Some are even tinier than that. Some are like gari. They're already there inside the wall of the uterus. So you can't get, you just get the ones that if it's blocking the cervix, it's blocking the tubes, is causing the uterine outline to be distorted. Because that's where the problem is. When the uterine outline is distorted, even because some women get pregnant, then 3-6 months they abort. Because the uterus needs to expand uniformly. But if a fibroid is in a part of the uterus and the baby is like 6 or even 7, sometimes even 3, any time, once the uterus is an automatic organ. Once it expands to a certain length, circumference, labor is going to start. Labor is automatic. That's why you notice that most twins are usually born like 8 months. They don't get to 9 months. Because by that time, the uterus has reached. Because people there are plenty. Sorry for speaking Yoruba. So they just have to, the uterus says, I've reached my maximum, you guys got to go. So that's how it works. So if you're now having a growth of 2 or 3 kg already, in uterus, and what happens again, something that also happens again, if you get pregnant with a fibroid, there's a possibility that the blood that is the fibroid is using to survive is now being shunted to the baby. In that case, that fibroids begin to degenerate inside of you. It begins, degeneration means it begins to spoil, it begins to rot. Then the woman starts having so many issues that at times we need to even take out that baby to save our life. Yes. So it's a very, but the definitive treatment is surgery. But what we usually face here in Nigeria, because there's no health insurance, is what we call the 2 F's of F. That's the 2 F's of fibroid. Number 1, finances. Number 2, fear. The surgery is expensive. And the people are afraid.
What are they afraid for? Is there a belief that anybody that goes to surgery dies, or
yes,
is against their religious faith or something?
Number 1, you see, in the practice, the person that is coming to you, the client coming to you, she has or maybe a couple, they have an expectation that they are coming with. You need to meet that expectation. Most of the time, the expectation is they want to get pregnant. Okay? Now, more often than not, they've seen somebody that has done fibroid and is not still not getting pregnant. And they've even seen someone that's done a repeat myomectomy that's still not getting pregnant. So they want to stay back. They usually, you know how we are in our societies, we look for people, where did you do your own? You're not pregnant. You did it last year. You did it 2 years ago. You're not pregnant. Let me go and see that doctor. That's what spurs people on, you know. But it depends on what the doctor meets or the time the patient comes. If you're already irredeemable, by the time, there's nothing the doctor can do. There's not much the doctor can do. But we take solace now in the fact that we have other artificial reproductive techniques that are also available to women who desire to have children, such as IVF, IUI, or even surrogacy. Yes, donor sperm, donor. So many reproductive techniques are available now. So, but the main thing is that women, they are afraid to die, because even our entertainment industry, they don't help. They're not really helping. In most of these Nigerian films, when somebody has a fibroid operation, it's either they die or they have one complication.
Okay, the way they shoot the movie.
Yeah, they just say they take it out. You know, they just say things, and then people take these things. People really, they take a lot of lessons.
But do you think people, like, this thing really send the shockwaves to people? Like, people really take it seriously, what they see on movies?
People they do. If you hear what I've heard,
Wow.
if you hear what
Wow.
I've heard in my practice, people really take things seriously. People take it's, I don't know, Yoruba movies. My people will be citing examples from movies for you when they come and see you. Somebody that they will not get pregnant again. They will do this, because they usually they thrive on negativity. It's a major operation, and yes, the patient can die, the client can die. It's very possible. There's a chance of that. Okay, with modern techniques now and advances in medicine and anesthesia, we rarely have those kind of cases. But at times the patient already comes at a very late stage. They've bled and bled and bled, and they're just bleeding. And some don't even actually have fibroids, but they are diagnosed with fibroids. They may have another condition called adenomyosis, which is like, how will I say, it's the senior elder brother of fibroids. And you see, the thing is, it's a dilemma for gynecologists. Because if you open up and you see adenomyosis, you need to take out that womb. You need to take out that womb to save that woman's life. But as the advances are happening now, if you take out her womb, she can take you out later with lawyers. Even though you want to save her life, you did it to save her life. Do you understand the dilemma there? You are doing that thing to actually save her life, because once you've touched the adenomyotic uterus, you shouldn't leave it inside. But some women will take you out. They can 1 billion in court. It will just be, bad publicity, and nobody wants that. So it's a dilemma at times. Even some fibroids are so bad, you have no choice. You just have to take out the uterus. So it all comes to number one: when you're seeing the couple or the client, you document very well, you talk to them very well, and then don't try and save costs for the client. Sometimes, most times, because of cost, we just do 1 or 2 scans and we take the patient into theater. It's not ideal. That's a failure of our healthcare systems here. It's not ideal. At least you should have a CT of the abdomen. You should have a chest X-ray. You should have an anesthetist ready. But all these people, they don't japa. So it becomes very hard. It becomes very hard. You just have to manage with what you have. We still just have to continue practicing. Even though at times when you go to some hospitals, if that kind of hospital where you just think this quackery, because we just have to make do with what we have. The economy is not helping, the government is not helping. And then you see, because the thing is that if you take statistics, how many fibroid operations are done in government hospitals? You can be going for 2 years. They will just be writing tests for you. Because they just don't have the manpower. There's no manpower. And that's where you can get it at least cheap. With maybe like 200 to 300, you can sort yourself out in a government hospital. But in a standard hospital, now you'll be needing 6, 7, 800,000. How many people can afford that? With unpaid 70,000 minimum wage.
That's very bad. Okay.
Yeah.
So, Doc, people say, or some people believe that the sperm of a man can trigger fibroid or can contribute to fibroid, the growth of fibroid.
No.
Is that true?
No. Like I said earlier, fibroids are idiopathic. We don't really know the cause, but we have some associated factors. There's association with if you're eating some kind of cheesy food, milky food. We've been known that fibroids grow with some particular types of food. So red meat, there's some particular food that we advise them not to take. But fibroid, the main issue with fibroid is a dormant uterus. Number one, if you're a black woman, you're at risk. If you're not having, if your uterus is dormant, as in you're not getting pregnant, you know, we have some people, they get pregnant like every 2 months. Usually, there's no time for that fibroid to grow. If you're having children and breastfeeding, is protective. Okay? During that time, your fibroids don't grow. So that's just it. So that's the reason why you see that in the days of our parents, it's not as much as now. Even though in the days of our parents too, it was still there. Because there's a particular film I watched when I was younger that they said a woman was, or you could have heard of it, that they said a woman was pregnant for 3 years. What usually happens in such cases is there's a fibroid indwelling there before the baby now comes and meets it, and then she now delivers. They now say, what's you know for Dumeta or Dumeta Lomo? No, she just had a fibroid, and the baby came and met it there, and then the baby came out. They now said, no. Do you understand? So, but it's not as common as it is today, because now look at it. In those days, between 18 and 24, many times by 24, some women have even completed their family. But now by 24, some people are still struggling with WAEC.
Yeah.
Yeah, and they don't even have any direction. 1 year learning tailoring, you live there. 1 year go and learn hairdressing. 1 year go and learn makeup. Just be going, you know, because of it's a failure of the system. Because there's no social security support for people, especially if you are unskilled. It becomes very hard for you to survive in this kind of. So,
Yeah.
and then right now, nobody wants to even put a liability at home. And then some cultures too, they make it very hard for their women to get married. So you see them getting married at 30, 35. At 35, you should advise of any gynecologist to use that after 35, you shouldn't even get pregnant again. Because all the eggs you are going to use, all the eggs you are going to use in your whole lifetime are already inside you from when you are 3 weeks inside your own mom.
Wow.
Do you understand?
Wow.
By the time the fetus is 3 weeks old inside the mother, all the eggs that fetus is going to use in her life is already inside her. So now look at that time.
So what are the
eggs,
chances that that egg being in that woman for 35 years before she finally gets married? What is the chances that those eggs can produce?
You see, those eggs are not, you are getting my point. That's where you now have some people having some funny diseases, Down syndrome, other trisomies, when you give birth late. Ideally we want you to give birth between 16 and 24. Peak age, 16 and 24. Wow. You're at your peak and the baby is at the peak. You can really take care of that child. You are still young and agile. You can take care of the children you have between 16 and 24. That's a wonderful time. But look at it. Wow. If you go to NYSC camp, safe, how many people are below 24 now? That's just it.
Okay, so Doc, how can, in fact, can fibroid be prevented? If yes, how?
No. Well, by reducing the risk factors, you may prevent fibroid. Early marriage, early sexual exposure, as bad as it sounds. You see that fibroid is, if you look at it demographically in Nigeria, the people in the southeast actually have the highest. They have the highest fibroid rate in Nigeria, and it goes to figure because they are the ones. The ladies don't marry on time. The ladies don't get married on time. Okay, in the north, 13, 14, 15, they're already gone. The uterus is busy, and the uterus is so busy. Sometimes they have 10, 12. So although they have their own gynecological issues, but fibroid is not a main concern to them. Yeah, the main thing is we need to increase our medical awareness. You know, increase our medical awareness, and then it's just simple. Any girl from even 18, even just once, if it's just once in 2 years, just walk into a scan center and have a scan done. Okay? Especially if you are seeing anything wrong with your menstrual cycle. If you've been doing 3 days before and you now start going to 4 or 5 days, or if you're using 3 pads in a day and it's now going to 4 or 5 in a day, if you're seeing blood clots while in your menstrual flow, if you're having back pain, excessive back pain, or if you're feeling bloated when you're having your period, yeah, so just go and just have a routine check so that we can nip it in the bud before it gets bad, and then we can advise you accordingly.
Okay. Can you hear me?
There's a device we can put inside of. Yes, I can hear you. Can you hear me?
Yes.
Am I audible?
Okay. Yes, you are.
So even if you're not ready to take out the fibroids, there's a device that is available that we can put into your uterus that will slow down the growth of the fibroids while you get ready for the definitive treatment.
Okay. So final question: what is the best diet to follow to prevent fibroid? Is there a diet?
Yeah, there's no really best diet, as I said. Main food is actually milk and then red meat. You just avoid those ones. So, but usually, I'm an advocate for plenty water, plenty fruits, fresh vegetables. You can never go wrong with those ones.
All right. Thank you very much, Dr. Bimbo Okusanya.
Thank you. Thank you so much.
It's
for
nice having
me.
you on the show today.
Yes. Thank you
All
so
right.
much.
Bye.
Have a wonderful day. Yeah. Bye.